Hi guys, my name is Lauren Wood and I'm a part of Ball State University's MSAT program. Today we're going to be talking about clinical decisions with evidence. Why are clinical studies important? They help efficiently find treatments that work. Healthcare providers can provide effective treatments in the initial visit. It shows researchers what does and doesn't work. And finally, it helps with medical advances. Now, these are only some reasons. There are many reasons why clinical studies can be important. The clinical question I have is a hot compress with physical therapy more effective at treating individuals with nonspecific chronic low back pain rather than using IFC treatment? Some relative information pertaining to both articles is low back pain, physical therapy modalities, electrical stimulation with and without therapy massage. So some things to know about low back pain is it affects up to 80% of the population. It can be anywhere from acute, subacute, or chronic. There are several risk factors that have been identified, but I've only listed some, which are like posture, your weight, your age, and your height. And there have been very few modalities that have been found successful to treat this condition for a long period of time. For physical therapy modalities, this is aimed to decrease pain and increase your function. So this is where you get in your stretching and your strengthening exercises. And then for electrical stimulation with and without therapy massage, it increases the circulation of body fluid. It obtains muscle contraction, reduces edema, induces analgesia, modifies the activity of the autonomic system, reduce centralized pain, and reduce referred pain. For Article 1, the purpose of this was to provide evidence on the most effective way to treat nonspecific chronic low back pain. The measures can be pain and function with the interferential current. The procedure there were 3 groups. The interferential current group received treatment 3 days a week, 30 minutes per session over a course of 4 weeks. Measurements were taken every 4 weeks and 4 months after the administration of treatment. The placebo group amplitude did not increase. But for the active groups, therapists increased the current amplitude until the patient reported they felt a tingling sensation. After every 5 minutes of the treatment, therapists would ask patients if the strong but comfortable tingling sensation was still present. If it wasn't present, then the therapist would increase the amplitude until that sensation came back. The treatment ended at 20 minutes, and the final 10 minutes were used to take measurements. The conclusion of this was there was no official results because this was not a clinical trial. It was more of a protocol. This is an appropriate choice of therapy that could increase the presence of low back pain treatments. But this is more to assist researchers to set up a clinical trial to see if the treatments provided has a positive effect. For Article 2, the purpose of this was to analyze the effectiveness of using massage therapy and electrotherapy with IFC. IFC is basically just a modality that is based off an electrical stimulation unit. The procedure was 62 patients that were randomly assigned to the groups. Experimental and control groups received treatment 2 times a week for 10 weeks. The experimental group received the IFC treatment in the dorsal and lumbar regions of the spine, while the control group received superficial low back massage. The conclusion of this was patients who experienced chronic low back pain had significant improvements with their pain levels, but also their quality of life. And this was found to happen with the IFC treatment. After speaking with my preceptor at CIO, he isn't a certified athletic trainer. He does recognize that this is an ongoing issue that has yet to find a long-lasting beneficial treatment. And he stated that clinicians need to look further than what the injury is presenting at surface level. So breaking down the healing process and what each levels of the healing process means, and then from there, determining what modalities or form of treatment can work based off those healing processes. And then if Brian were to perform any modality, it would be scraping. He mentioned this because it activates the body's natural inflammatory healing process. This happens because the second you start scraping, you are able to find the area that is most effective or that is most affected. And from there, that's the area you can work on. And while you're working on the patient, they are currently activating their healing process. So it's not only providing treatment, but the patient is also starting to feel better during this treatment, whether they realize it or not. The end result of this entire presentation is that low back pain is common amongst all individuals. Patient visits can be more effective with these studies. Manual exercises can be effective at treating low back pain, and long-term treatment should be tested to see if electromassage can be used for a more permanent modality. I hope this helps you guys when you are thinking about creating your own study, if you would like, on low back pain, or if you are treating a patient that has chronic low back pain, or if you yourself has chronic low back pain. Just take into account your healing processes, and then from there determining how deep you want the level of treatment to go. Thanks, guys.